Hello, everyone, and welcome back here at AWS On Air. Again, the official live streaming track at reInvent 2020. Here I am joined for yet another Voice of the Customer session, this time with a very special guest from the Canadian Institute of Health Information. Ron Huxter joining me is the Vice President and Chief Information Officer over at the Canadian Institute of Health, CIHI. Ron, thank you so much for joining me today.
Oh, it's a pleasure. Looking forward to it.
Awesome. Well, I am super interested to see what CIHI is that the how I pronounce the acronym?
Yeah, it's a much easier way. CIHI is
Awesome.
fine.
So yeah, CIHI has, to the best of my understanding, performed a transformation and journey into the cloud, and there is no two stories are the same here. So I'm very interested to see how that turned out for all of you. But as the vice president and chief information officer, I'm sure you've had a very close relationship with this migration and with this journey itself. Why don't you tell us a little bit about CIHI, what you all do, and then we can dive deeper on that migration itself.
Yeah, the background will help us understand why we had to go to the cloud for a bunch of obvious reasons. But CIHI is a pan-Canadian not-for-profit organization. We produce analysis, comparable data, and action data on how the healthcare system is performing in Canada. So we go from the right coast to the left coast, from the south to the north. We get the information from all the various jurisdictions, put them together, and we put the analysis together to find out how the healthcare system is performing, where it can be looked at to be improved, and then comparable for the jurisdictions to base their policies and their healthcare programs on. So it's really a really interesting mix of massive data collection, really sophisticated analysis and advanced computing, and then a whole publishing arm about how we distribute the data to the stakeholders and what's available on our public website. So it was really, really important to try and take advantage of the cloud because it gives us the ability to remove any IT lags in the production and the collection of data and the production of the reports, right? We really need to have the ability to acquire the infrastructure quickly, to deploy our solutions quickly. We really need to be able to test and play with new AI, with new machine learning stuff, without having to buy an entire data center and then strand it once we're finished the project. So it's led us to an ability to do a ton of piloting and figuring things out on the cheap. And it also gives us the ability that when we actually need to burst for data capacity, for storage, for acquisition of stuff, we can do that in the cloud instantly. So it was really all those kind of business enablers that the cloud provides us was the real reason for going there. Now, getting there was a bit of a fun trip. There are some secret recipes and sauces we've kind of figured out along the way, and that's what we'd like to share with people because in the healthcare sector, which is what we're trying to help out with this transition, it can be a real game changer if we can get the entire sector kind of leaning into the cloud technologies.
Certainly so. And, after hearing that response, my initial reaction is, where can we even begin? There's so much to talk about here. I know we have about 20 minutes, but we'll try our best to make good use of the time. I've spoken to quite a few other customers here, and at organizations, we find that this term data siloing is often a challenge, right? The data may live in certain parts of an infrastructure that other organizations at the company may want to access. But, with my naive understanding here, if we're talking about the entirety of the breadth of the healthcare system and data that you deal with at CIHI, this may not just simply be infrastructure silos. This is geographic silos, right? This data may live on premises on local devices that you could be tasked with trying to aggregate for reporting. And prior to cloud, that seems like that could be a really monumental undertaking.
Yes, it's further complicated or enhanced by our extreme observance of our data sharing agreements, right? So we're talking about healthcare information, the most personal, most privacy sensitive type of information around. So we have really ironclad data sharing agreements with all of our stakeholders. And job number one is to protect that and to however we can manage the better use of the data to respect those and to work with our stakeholders in that. So that's the first job. That explains a few decisions we made about going to the cloud coming up. But you're right. CIHI is celebrating its 25th year last year. So we are now, a mature-ish organization. We collected massive amounts of pan-Canadian data sets. So there's roughly 28 or 30 pan-Canadian data sets that have been collected from programmatic perspectives and usually stored in relational type databases, right? So moving to the cloud not only gives us the ability to be flexible on the infrastructure, now we can start talking about data lakes. We can start talking about how you actually collect the data and store it so that it's not set up in a already like a pre-biased relational model, and it's actually there for a data lake for cross purposes. Because as CIHI has matured, its advanced analytics capability has moved into not only looking at indicators or looking at specific themes like opioids or hospital harm or suicides. It's now a population-based thing where you have to integrate a ton of data. So the integration of that data, which allows you to look at a population of people, seniors or youth or whatever the case may be, it's imperative that we actually get those cloud features set up and we get all our data kind of freed from the silos, put into the lakes, and then be able to be integrated, and then launch the AI and the machine learning folks on top of it, right? So like I say, the big reason at the start was to give us the ability to not have technology prevent us from doing pilots, prevent us from scaling up when we needed to, and prevent us from not being able to access the data in an integrated way. So, and then you can get really sophisticated with all the new tools that are available in the cloud, all the analytics, the research pieces. I mean, I saw on your resume R and Python, like we're just starting to move into those whole new areas because it's freed us up from the data centers on premise.
Oh, certainly. And, you say that with a smile on your face. I know it always feels better to move to something that you're doing because you want to do it, or, you're exploring new horizons than feeling locked down to, tasks of maintenance on some of your own infrastructure. But, what I'm really hearing here is you sort of have this hierarchy of needs, right? The first of which is, making sure the technology is not actively prohibiting you. You want to be able to store your data and do so in a way that, you have the storage space, you have the ability to scale up and down there, you have the latency that that you're satisfied with, and then you make that open and accessible. You mentioned data lakes, opening data up to multiple arms of the organization such that you're not either duplicating it or, having people denied access to it. And then down the line, sort of in full actualization, is these things that you mentioned, like insights, right? We have through aggregation, or CIHI has through aggregation of this data in the data lake, enables you to experiment, perform, dabble with machine learning and AI to be able to now have some new features that could exist that otherwise would not have been possible. And we'll get into that in just a bit. But you mentioned that the journey to cloud, it obviously doesn't happen overnight. You've been on AWS for a little bit now. I don't remember. I think you said it was a few months or maybe a year or so. That journey does not happen overnight. I can't restate that enough. How has that journey been thus far from day one of moving from on premises to where you're at now?
Yeah, so it's been fascinating actually. We started with a strategy, a cloud strategy. We had to figure out the direction and the vision and the mission and get people kind of all pointed in the same vector direction. We used a third party to do that. And we actually came up with a bifurcated strategy. So we took all of our office automation and we outsourced that to a software as a service. We took all of our business applications and data and moved it, or planned to move it into an AWS environment, right? So the most important thing from a CIHI perspective was when we were changing the infrastructure, when we were moving the data, we had to be respectful of those data sharing agreements and our commitments to our security and privacy programs. Like that is number one job inside of CIHI as far as technology goes, right? So in order to do that, we had to make a decision. And so this is kind of the recipe we used to move into the cloud. The first decision was to use our internal staff to move to the cloud. That meant that we were going to take a little longer, have a few bruised knuckles and a few bruised elbows and kneecaps and feet. But in the end, our staff would be the knowledgeable folks to operate it in the cloud going forward. It also allowed us to select the infrastructure as a service mode of AWS. Our information security and our security and privacy risk programs all translated into the cloud. So we controlled those. We kept that policy, we kept the operations, we kept the monitoring and the break fix all within inside staff. So that was the very first important decision, was to do this as infrastructure as service with existing staff. So the journey took a little bit longer than it could have if we had hired guns to come in and like deploy in the cloud in 6 months and walk away. But we couldn't do that because of our situation in the healthcare sector, right? Now, the other interesting piece is the money. People are often afraid of spending too much money when they move into the cloud, or it's very expensive and stuff like that. So we set up a really kind of cool way of doing a comparison through a total cost of ownership of our on-prem and at the various stages as we moved into the cloud. So our new cloud business office, which is another thing we use, which was to manage all of the contractual arrangements and the use of AWS through a cloud business office, is based on an annual TCO. So we wanted to make sure we didn't have runaway costs because people were doing things that were not managed properly or not aligned properly. So we created what we call a Cloud Center of Excellence, which is really an architecture review board, so that everything that was being built and deployed in the cloud was being done according to one enterprise architecture. So there's a couple of things that were really dynamic tensions in the whole system move, but it made sure we got into the cloud at the same or less dollars as our TCO for our on-premise data center. We got into the cloud with the exact same or better enhanced security profile than we had before. And as a piece of shameless self-promotion, we just had an ISO 27001 recertification about a month after we went into the cloud. So that was pretty cool. And then going forward, all of the technologies are going to be leveraged in all the new application builds through that Cloud Center of Excellence. So we decided in order to make this happen, we had to do it rather quickly. So we picked a lift and shift approach. So we just basically lift everything and shift it into the cloud. Now, a lot of companies may be looking at the option of getting their applications and stuff cloud ready, which is just a whole bunch of work. But what you do in that case is you also have to keep the old applications running. So we moved everything into the cloud, and now we are optimizing everything that we have, because it's a lot easier to fix things and to migrate things and to optimize stuff in the cloud, right? So we've made a huge advancement in the technology practices, our infrastructure, when we're reaping a whole bunch of unexpected benefits. So one of the big unexpected benefits was our disaster recovery. Right? So our on-prem data centers required a full business continuity planning and disaster recovering piece. That's a button right now.
Yeah.
Is evidenced by the fact that when COVID-19 hit, CIHI went from its locations across Canada, 4 of them, to work from home in 4 days.
Wow, that's.
And we actually moved to the cloud during COVID. So June was a really important month of this year, because that's when we actually moved. It was just kind of like I was telling David, our CEO, this is a geek's dream to actually move 2 data centers into the cloud with nobody in the office.
Yeah, no, that is, when I hear this story, this is a cloud migration done right. We heard in Andy Jassy's keynote in week 1, his 8 tips to being immensely successful as a company in not just these times, but how the challenge of companies being successful for such a long point in time. And a lot of the 8 points that he mentioned are represented right here in this story that you talked to. I mean, what I'm seeing is a top-down strategic buy-in to identification and assessment of TCO. Again, TCO for an entire organization's infrastructure is rarely something that can be effectively decided spontaneously by boots on the ground software engineers, right? So that top-down leadership and unified front is extremely important. But what we also saw was you didn't neglect the reality of the cost of learning, right? a lot of folks think, like, yeah, it's, switching technology is just as simple as, flipping a switch in certain scenarios. And, while for, failover or multiple disaster recovery scenarios in AWS, it can be a switch. The reality is you're learning some new picks and shovels to be able to do the job. And so, giving the affordances and investing in the people that will be your builders, to be able to effectively utilize that architecture and giving them the time. Again, looking at the time horizon of a year for your TCO. Andy talked a bit about not being short-sighted here at AWS and not going quarter by quarter, right? An institution as broad sweeping as CIHI and for the type of work that you do, thinking for the long term is not really a reasonable option. It's a necessity. So being able to see that as well is quite enlightening. And then lastly, one thing that I heard that paralyzes a lot of organizations is how to start the migration. You have top-down buy-in, maybe your builders are excited and they're ready to innovate. But a lot of companies that I have seen get trapped in this desire to sort of have the entire migration architected out and not to deploy any infrastructure until they have their monolith completely decoupled into microservices and all of that. And I don't think that's the way to do it. You talked about some of the challenges of keeping some of the old systems running while trying to, lift and shift. But I still think that is the right approach, right? Lifting and shifting to the cloud, you mentioned there are so many benefits of being able to optimize there. You get a lot of the affordances in monitoring and cost tagging and more deeply understanding the applications you've already written. And then you can break them down and prioritize based on whether you want to improve latency or what saves you the most money the quickest, right? So I know I'm gushing and summarizing the story you just told me, but I think this is really a playbook for a lot of companies that are looking to move to cloud. Nonetheless, ones in the healthcare space where, like you said, data compliance and security is we say it's priority 0 here at AWS, but it sounds like it is exactly as high of a priority over in your space.
Yeah. So it's the point you made around the staff and the learning is really, really, really special too. We kind of adopted our approach to reinforce that. So we did decide to use internal staff. We decided to take the little bit more of a painful approach. A lot of training. So AWS has a significant amount of training opportunities and all kinds of people to learn from. But we also trained the migration through our environments, right? So we did not move everything in one day. We took our time and we architected an AWS landing zone. And then we moved our development environment. And then we made mistakes and we fixed it up. But it wasn't a business critical thing because it was a development environment. Then we moved on to the UAT environments in the pre-prod. So we went environment by environment, learning all the way. So when we did to do the production cutover, it basically was a switch, but it was a lot of learnings through the other ones. So it depends how you stage the project and you stage and you allow for the mistakes, you allow for the fail fast, you allow for the learnings, right? Because book learning, CBT learning, all that kind of stuff is okay, but really doing it and learning from the mistakes is really important.
Yeah, exactly. And I think, those mistakes, they oftentimes say that when you really learn is when you make those mistakes, or when you're frustrated, you aren't, necessarily getting it right on the first try. And to your point, identifying that expertise was valuable in-house for the long term and giving your employees their own way to do that is critical, right? This isn't just about getting the deployed application out the door as soon as possible in terms of, maybe having a SaaS provider or an ISV do that on your behalf, really understanding, no, we want to own, operate, and optimize this for the long haul is really long-term thinking, and it's something that's really commendable. And again, we at AWS here try our best to offer a variety of resources to help train in an ongoing manner. I mean, in a way, even this is part of it, right? You shouldn't reinvent the wheel when it comes to your infrastructure, but wherever possible, we don't want to see customers going through the same challenges or roadblocks that other customers may have gone through. And so being able to hear stories just like this helps to enable all of the customers that may be performing migrations down the line that could look similar to CIHI's.
Yeah, well, no, we're like I say, we're more than happy to share our experiences because it's been a really good experience for everybody. I think looking back, there's a lot of people convinced now that they can do almost anything now, right? So we're getting ready for the next wave, Richard, which is full optimization, full use of AI equipment, like full use of a whole bunch of stuff that we only thought was, not possible a short while ago. So the other piece I want before we go is moving to the cloud isn't the end of the journey. Moving to the cloud is meaning you can have your infrastructure and you can have your new technology, but it doesn't mean that you're not going to stop learning and optimizing, right? So our TCO and our cloud business office approach was to get into the cloud for the same or less to keep our financial accountants and controllers happy because we weren't spending any more money than we were before. But now we're looking to cut those costs by 10, 20, 30, 40, 50% as we learn how to do more and better things in the cloud. So there's an equal amount of time after we get there to optimize stuff. Things as simple as putting all your applications in the same server type so you can shut them down overnight when you don't need them, right? You're talking about like a proper application portfolio management and investment piece. You have to know what applications you need on a 24/7 basis, or do you need them once a week or once a year? Like we have 10 applications we use twice a year around the fiscal cycle. They're now sitting on a shelf somewhere until we need them. They're costing us nothing. Before, they were costing us heat, space, security, everything going in the data premise. So there's a whole way of running the business differently that fundamentally changes how you operate IT, right? And it is kind of cool. And the coolness factor is what's gotten everybody kind of on board.
Well, I certainly agree, but it's always great to hear it from a customer. So, Ron, thank you so much. I think we're at about time here, but in just these past 20 minutes, I've learned so much about CIHI, the work that you've done, your migration to the cloud, and it really feels like the sky's the limit going forward. Again, spending less time on some of the IT and maintenance of applications and infrastructure, and on some of the more exciting bits, like being able to cut the costs of your existing applications and blaze some new trails with AI and machine learning and accessing the value that may have been locked away in some of the data that you've already had access to. So again, a very exciting story. This is the end of the Voice of the Customer session here with the Canadian Institute of Health Information. Again, joining me here, my esteemed guest, Ron Huxter, Vice President and Chief Information Officer at CIHI. Ron, it's been a real pleasure. Thank you so much for joining us.
Oh, you're more than welcome.
Wonderful. Well, we have more programming coming up here on AWS On Air, so stay tuned, and we will be right back. See you soon, everyone.